In December 2019, the China office of the World Health Organization, WHO, received news of an isolated outbreak of a pneumonia-like virus in the city of Wuhan. The virus caused high fevers and shortness of breath, and the cases seemed connected to the Huanan Seafood Wholesale Market in Wuhan, which was closed by an emergency order on January 1, 2020. After testing samples of the unknown virus, the WHO identified it as a novel type of coronavirus similar to the deadly SARS virus that swept through Asia from 2002 to 2004. The WHO named this new strain SARS-CoV-2, Severe Acute Respiratory Syndrome Coronavirus 2. The first Chinese victim of SARS-CoV-2 died on January 11, 2020. Where, exactly, the novel virus originated is hotly debated. There are two leading theories. One is that the virus jumped from animals to humans, possibly carried by infected animals sold at the Wuhan market in late 2019. A second theory is that the virus escaped from the Wuhan Institute of Virology, a research lab that was studying coronaviruses. U.S. intelligence agencies maintain that both origin stories are plausible. The WHO hoped that the virus outbreak would be contained to Wuhan, but by mid-January 2020 infections were reported in Thailand, Japan and Korea, all from people who had traveled to China. On January 18, 2020, a 35-year-old man checked into an urgent care center near Seattle, Washington. He had just returned from Wuhan and was experiencing a fever, nausea and vomiting. On January 21, he was identified as the first American infected with SARS-CoV-2. In reality, dozens of Americans had contracted SARS-CoV 2 weeks earlier, but doctors didn't think to test for a new type of virus. One of those unknowingly infected patients died on February 6, 2020, but her death wasn't confirmed as the first American casualty until April 21. On February 11, 2020, the WHO released a new name for the disease causing the deadly outbreak, Coronavirus Disease 2019 or COVID-19. By mid-March 2020, all 50 U.S. states had reported at least one positive case of COVID-19, and nearly all of the new infections were caused by community spread, not by people who contracted the disease while traveling abroad. At the same time, COVID-19 had spread to 114 countries worldwide, killing more than 4,000 people and infecting hundreds of thousands more. On March 11, the WHO made it official and declared COVID-19 a pandemic. Pandemics are expected in a globally interconnected world, so emergency plans were in place. In the United States, health officials at the Centers for Disease Control and Prevention, CDC, and the National Institutes of Health, NIH, set in motion a national response plan developed for flu pandemics. State by state and city by city, government officials took emergency measures to encourage social distancing, one of the many new terms that became part of the COVID-19 vocabulary. Travel was restricted. Schools and churches were closed. With the exception of essential workers, all offices and businesses were shuttered. By early April 2020, more than 316 million Americans were under a shelter-in-place or stay-at-home order. With more than 1,000 deaths and nearly 100,000 cases, it was clear by April 2020 that COVID-19 was highly contagious and virulent. What wasn't clear, even to public health officials, was how individuals could best protect themselves from COVID-19. In the early weeks of the outbreak, the CDC discouraged people from buying face masks, because officials feared a shortage of masks for doctors and hospital workers. By April 2020, the CDC revised its recommendations, encouraging people to wear masks in public, to socially distance and to wash hands frequently. President Donald Trump undercut the CDC recommendations by emphasizing that masking was voluntary and vowing not to wear a mask himself. This was just the beginning of the political divisions that hobbled the COVID-19 response in America. In the early months of the COVID-19 pandemic, with billions of people worldwide out of work, stuck at home, and fretting over shortages of essential items like toilet paper, global financial markets went into a tailspin. In the United States, share prices on the New York Stock Exchange plummeted so quickly that the exchange had to shut down trading 3 separate times. The Dow Jones Industrial Average eventually lost 37% of its value, and the S&P 500 was down 34%. Business closures and stay-at-home orders gutted the U.S. economy. The unemployment rate skyrocketed, particularly in the service sector, restaurant and other retail workers. By May 2020, the U.S. unemployment rate reached 14.7%, the highest jobless rate since the Great Depression. All across America, households felt the pinch of lost jobs and lower wages. Food insecurity reached a peak by December 2020 with 30 million American adults, a full 14%, reporting that their families didn't get enough to eat in the past week. The economic effects of the COVID-19 pandemic, like its health effects, weren't experienced equally. Black, Hispanic and Native Americans suffered from unemployment and food insecurity at significantly higher rates than white Americans. Congress tried to avoid a complete economic collapse by authorizing a series of COVID-19 relief packages in 2020 and 2021, which included direct stimulus checks for all American families. The race for a vaccine. A new vaccine typically takes 10 to 15 years to develop and test, but the world couldn't wait that long for a COVID-19 vaccine. The U.S. Department of Health and Human Services, HHS, under the Trump administration launched Operation Warp Speed, a public-private partnership which provided billions of dollars in upfront funding to pharmaceutical companies to rapidly develop vaccines and conduct clinical trials. The first clinical trial for a COVID-19 vaccine was announced on March 16, 2020, only days after the WHO officially classified COVID-19 as a pandemic. The vaccines developed by Moderna and Pfizer were the first ever to employ messenger RNA, a breakthrough technology. After large-scale clinical trials, both vaccines were found to be greater than 95% effective against infection with COVID-19. A nurse from New York officially became the first American to receive a COVID-19 vaccine on December 14, 2020. 10 days later, more than 1 million vaccines had been administered, starting with healthcare workers and elderly residents of nursing homes. As the months rolled on, vaccine availability was expanded to all American adults, and then to teenagers and all school-aged children. By the end of the pandemic in early 2023, more than 670 million doses of COVID-19 vaccines had been administered in the United States at a rate of 203 doses per 100 people. Approximately 80% of the U.S. population received at least one COVID-19 shot, but vaccination rates were markedly lower among Black, Hispanic and Native Americans. In America, the COVID-19 pandemic impacted everyone's lives, but those who died from the disease were far more likely to be older and people of color. Of the more than 1.1 million COVID deaths in the United States, 75% were individuals who were 65 or older. A full 93% of American COVID-19 victims were 50 or older. Throughout the emergence of COVID-19 variants and the vaccine rollouts, older Americans remained the most at risk for being hospitalized and ultimately dying from the disease. Black, Hispanic and Native Americans were also at a statistically higher risk of developing life-threatening COVID-19 symptoms and succumbing to the disease. For example, Black and Hispanic Americans were twice as likely to be hospitalized from COVID-19 than white Americans. The COVID-19 pandemic shined light on the health disparities between racial and ethnic groups driven by systemic racism and lower access to healthcare. Mental health also worsened during the COVID-19 pandemic. The anxiety of contracting the disease, and the stresses of being unemployed or confined at home, led to unprecedented numbers of Americans reporting feelings of depression and suicidal ideation. In the United States, the 3 long years of the COVID-19 pandemic paralleled a time of heightened political contention and social upheaval. When George Floyd was killed by Minneapolis police on May 25, 2020, it sparked nationwide protests against police brutality and energized the Black Lives Matter movement. Because so many Americans were out of work or home from school due to COVID-19 shutdowns, unprecedented numbers of people from all walks of life took to the streets to demand reforms. Instead of banding together to slow the spread of the disease, Americans became sharply divided along political lines in their opinions of masking requirements, vaccines and social distancing. In general, Politically liberal Americans supported vaccine mandates and wearing masks in public, while politically conservative Americans chafed against public health mandates, prompting mask wars and anti-vax protests.